That is some good water. Water. We need it. It is a basic human need, essential to all forms of life. However, today we're not really talking about water. We're talking about the elimination of water and maybe some other things that we ingest and put into our body. How does it happen? What do you do if you have a problem with the elimination system? It's cool. It's cool, man. I'm actually going to share with you how to troubleshoot all of these problems that you may be running into. I do have my notes situated right above, so I will be glancing at them frequently. I would like to first just remind you, you need my video and the slide presentations that I shared with you to the side. That would help you figure out exactly what I'm referencing. All right, ready to go? Because I'm ready. Hope you're ready. All right, thanks, Freddie. Slide 2. Well, we refer to going to the restroom or peeing as voiding. You'll hear void used actually more frequently than the other words such as micturate. Ugh. In fact, let's not use that in front of the patient because they won't have any idea what you're talking about. So we can say urination, urinating, how many times have you voided? That's more of the appropriate terms for you. You have got a muscle that actually lines your bladder and it stays relaxed as the bladder is filling. And then from the brain comes the signal, it's time to pee, and it squeezes down. Like it's saying, I'm way too full, get rid of this urine. The thing is that you have two sphincters, the internal sphincter that's right at the neck of the bladder and the external one. What do you think that one is? Probably at the external. Yes. It's right by the outside of the body. The thing is those must be pretty darn strong to hold urine against the two, to hold urine against the muscle activity of the bladder. So, normal sequence is bladder gets full, send the signal, hey, I'm going to start squeezing, you better release. The brain can send the signal back down and says, hey, this is a good place, go ahead and I'll open up the sphincter, you squeeze. It's a coordinated function. If we don't have that coordination, we have some problems. And medication interferes with any parts of those pathways. But a lot of times it's the conscious relaxation of the sphincter which allows you to experience the effect. Yes. All right, slide 3. This is a basic anatomy or anatomical list of organs that are involved. So I am not going to go over those just because it is something that you usually bring to the table, basic knowledge of the urinary system. The bladder is a muscle, the urethra is usually shorter on females, longer on males. The ureters connect the kidneys all the way down to the bladder, and they're connected onto the bottom of the bladder, not the top, on the very bottom. And just some other terms such as glomerular filtration rate. Normally, we should have a high glomerular filtration rate. This means that your filters are really, really active and they're getting out all of the metabolic waste and keeping in the fluids and the good electrolytes that your body needs, and helping with the pH balance too. So just kind of refresh yourself on it, but I am not going to go into detail explaining this to you. So, because I care about what does a nurse do. All right, slide 4. This is just very basic, promoting normal urination. Well, most people, it kind of depends upon the age and the culture that they grew up in, but we want to provide privacy. It is normal to have this be a very private thing. In fact, you must take this nonchalant approach. Sir, it's time to urinate. Here's your urinal. There you go. There is nothing more awkward than you asking, do I need to turn around? Is it okay if I stay in here while you pee? Like, don't make it awkward. You're a professional. Here's your urinal. Time to go. Or let me get you to the bedside commode. I'm going to stay in here for your safety. Don't ask. Just tell. So Provide privacy as much as possible. Make sure your visitors exit the room, and sometimes I don't even ask, is it okay if grandma stays? No, I just say, Grandma, would you like to step out while he's using the restroom? And if grandpa wants grandma to stay, he's going to say, she's okay. Usually by that age, they're fine with all bodily functions in front of each other. But anyway, assist with positioning. Gentlemen, you are more likely going to feel better to pee if you're what, lying down flat? No. Stand up. In fact, some of my patients will not be able to urinate unless they're standing up, men-wise, talking about guys. For females, bedpans are a little bit embarrassing, but if they have some kind of mobility restriction, it's okay. You know, roll them over to the bedpan and sit their head up to a semi-Fowler's position. Facilitating toilet routines. Most patients void upon awakening, after meals, after large volumes of fluids. Like if you were to give them an IV fluid bolus, don't act surprised when they call you and they say, I need to use the restroom. It should be like, I'm going to plan on them asking me, so I'm going to go ahead probably and just schedule a time to go in the room. And most people void before bedtime. All right, I think that's all I have for that one. Let's go to slide 5. Normal versus abnormal patterns. So you've recognized the normal patterns of going to the restroom. How about, I probably voided like 20 times today. That should ring a bell in your head as, whoa, that's actually a lot. Normal's like 8 to 10. Evaluate yourself. How often do you use the restroom? Probably more like 5 to 7, maybe. So that should tell you you're not drinking enough. Just saying. Characteristics. Urine is normally a pale to maybe an amber color. It should not be bloody. It has a kind of an ammonia smell, but we should not have a pungent smell that makes your nose hairs curl. That's considered outside the normal range. Clarity, it should usually be clear. It can have a bit of a turbulent appearance. Say somebody's not drinking enough, they're a little dehydrated, so it will be amber and kind of, I hate to use this word, swirly type of look to it, thickness, but that's turbulent. But it should not be cloudy. Cloudy is not good. Or opaque. Ugh. Ugh. We should never have blood in the urine. That's called hematuria. Even if you have a little bit of blood, it might be like a pink color. Maybe it could be associated with UTI, urinary tract infection. But no blood should ever be in the urine. Okay, that would be your typical urinary elimination. Let's go to slide 6, developmental factors. Oh my goodness. If you've ever had a newborn before, just expect it. You're going to be changing a diaper probably 12 times a day, maybe. Infants all the way up to toddlers have, poor or absent control of the urinary sphincter. A lot of times our 18-month-old to 36-month-old toddler, we will start introducing them to the routines of going to the potty. It's basic toilet training happens at this point. But I will say it is highly individualized, and just because a 2-year-old is, a 24-month-old is not potty trained, it doesn't mean anything. There's nothing wrong with your kid. It just doesn't want to use the toilet and likes the diaper. So when we look at children, there are a few problems that they experience, particularly enuresis. That's just peeing at any point in time. Many a times enuresis in a early school-age child happens just because they get intensely involved in like a game, a test, or they're just so absorbed in activity and they wet their pants because they totally ignore the signal to go. Doesn't mean that they have a problem or that they're totally regressing. It's just, it happens. School-age kids pee on themselves from time to time. Now, if you're an adult, maybe not so much. Nocturnal enuresis, bedwetting at night. Girls don't have as much of a problem with this. Boys, yes. In fact, 8% of boys still wet the bed until they're up to 10 years old. So, and it's just normal. The sleep patterns, they sleep too deep. A lot of times you can use a bed alarm, which we can talk about in a little bit, but there's nothing much to this. It happens. Primary nocturnal enuresis is bedwetting in a child who is not primarily trained to be consistently dry at night. Nothing, abnormal about that one. Secondary is when you have a child who has been trained to not wet the bed, and then they wet the bed occasionally. Once again, not anything too crazy that you need to put the kid on medication for at this point. Maybe restrict fluids. In my personal opinion, the bed alarm is just cruel. It's a pad that you put on your bed, and it senses whenever it gets wet, and so it lets off a pretty nasty alarm that will wake you and your kid up. So I see that more of like a negative feedback type of behavioral change. Okay, sorry. Slide 7. Older adults. Kidney function decreases. In fact, this is a major concern of our older adults, is this change here, because their glomerular filtration rate, those little filters, it declines just naturally with age. And then on top of that, we're giving them more medications. We're giving them, a lot of, actually, let me back it up. We're giving them more medications, and a lot of times they decrease their fluid intake. So they're kind of having a twofold punch to the kidneys. So we're always concerned with our older adults and their illumination. That is a very, very common question that we ask of them. Let's see, not to mention that they start having problems with the elasticity and the muscle strength. Throw in there a few kids and you've got a real mess on your hands when it talks about, or when you're thinking about bladder control. And let's see, chronic diseases that affect the kidneys. I'm particularly thinking of diabetes, and for guys, BPH, which is benign prostatic hypertrophy, fancy for enlarged prostate. That's always a problem that we're going to be discussing with patients in terms of how it affects their urination. And for females, menopause. Menopause is up there on the list. You know why? Menopause causes vaginal dryness, and it actually, the flora changes whenever you have a dry vaginal area, and you'll actually have lots of UTIs if you don't have the normal protective flora down there. So just put that in the back of your head. Slide 8. All right. Personal. So some people do have bladder shyness. That's an actual thing, and they will not go into a stall, like a public bathroom, to urinate. There's the loss of dignity that comes with, say, going into the hospital and having a roommate and having to use the toilet. So there's a lot of anxiety associated with that. The sociocultural, some patients, for either personal or maybe even cultural reasons, maybe even religious reasons, don't want somebody of the opposite sex helping them with something that's so private. So they're within their right to ask for, say, a female nurse if it's a female patient, or vice versa. They may even wait for a family member to come in versus a stranger, you, that they just met. Normal, all normal. Nutrition, substances that contain caffeine, tea, Coca-Cola, even chocolate can actually act as a diuretic. Another one that's not naturally occurring, that's very common, alcohol. How many times have you had, a couple of beers and you find yourself in the bathroom more times than not? Reason being is that the alcohol actually suppresses your release of the don't pee hormone, also known as the antidiuretic hormone. So, a few beers in, you better find where your bathroom is, because you're going to be urinating quite often. So This is always a helpful piece of information when you have a patient who has, say, urinary incontinence, and we're going to recommend that they actually limit their alcohol and caffeine, maybe tea intake, because it affects how well they can hold the urine and control it. All right. Let's see. Hydration. So the kidneys, control how much water we lose, how much water retain, right? Well, what if we have somebody who is excessively losing the hydration, or who's putting themselves at risk for dehydration, such as maybe a runner or somebody who has heavy exercise? We actually don't want them to hydrate with water. We do, but we would like them to hydrate with some electrolyte replacement drinks, such as Gatorade, especially if they have vigorous activity or prolonged activity. So their hydration status will affect their urinary elimination. They won't pee as much. Surgery and anesthetics. Surgery, specifically speaking, if they're operating in the pelvic region, they could actually nick a ureter. That has various effects on the urinary tract. That's just sheer manipulation. More importantly, the anesthetic agents, whenever they put you to sleep, it actually can alter your ability to urinate afterward. A lot of people experience urinary retention or hesitation after surgery. So something to stick in the back of your mind. It's transient. Some patients do actually have to have their discharge postponed because they are not able to pee. I say drink more water and take a walk, and you might earn your ticket home. If not, we'll have to catheterize you. The loud mouse back there. You're a loud mouse back there.
Sorry. I'm hungry. My house. Ready to eat.
Next slide, slide 9.
You still recording?
Yes.
Am I too loud?
Yes.
Yeah. Are you hungry?
Baby.